Hi guys, welcome back to my channel. So today in this video, I will be discussing some of the concepts that we covered in med search for diabetes. So it's not gonna be a lot. I'm not gonna be discussing all of it. It's just for me also to be more familiar with the concepts because again we have an upcoming exam, and basically what I'm gonna be discussing is what I remembered, and hopefully somebody can benefit also from the info that I would give today for the upcoming exam. Because again, we only have few times to actually, or a few time frames to actually study. So again, diabetes is a disease in which the body's ability to produce or respond to the hormone is impaired, resulting in abnormal metabolism of carbohydrates and elevated glucose levels. So it was discussed before that if you have diabetes, there's not basically enough, the pancreas is not capable of making enough insulin to be used by the body. Because again, the glucose needs insulin to be able to enter the cells so that we can use it. So there's two ways, again, like not enough insulin, and the other one is like if the receptor of the cell is not able to take in insulin, so or take in glucose, because insulin is not able to enter because there's a resistance, so insulin resistance. So from the past lecture from our class before, we were taught that again there's three types of diabetes. We have type 1, which is the insulin dependent. So usually this is the type of diabetes that is genetics, right? So you're born with it, that your beta cells is kind of like destroyed, so it's not, the pancreas is not even like capable of making any insulin, so that's why you need to be given insulin. Because this one is, they detect this one like when the person is younger. For type 2, it's different because most people who have type 2 diabetes is like it's non-insulin, and they develop the disease because of certain reasons, like could be factors caused by being overweight, because most of the people who have type 2 diabetes are obese, and also lifestyle, right? So if they adopt a lifestyle that causes the insulin not being able to support the body, then they would develop type 2 diabetes. And the third type of diabetes is the gestational diabetes, which is like for females when they're pregnant. So if they have gestational diabetes after they give birth, they can develop this problem, and if they don't develop it after pregnancy, it puts them on higher risk to actually develop type 2 diabetes afterwards and later in their life, if they're not able to manage the disease properly, or if they're not taking care of their body. Again, so a lot of people like to eat sweets, coffee. Also, I like drinking coffee with sugar, but because I don't like. That's why I might need to also change my lifestyle. But again, those are the reasons that if it's overeating of too much sweet can cause diabetes also. So aside from this, this three types again, because I know Professor Harvey, he said that the DKA, diabetic keto acidosis, we're not gonna be DKA and the HHG, we're not gonna cover that one until critical care. There's also other things that can cause increase of blood sugar. So there's medications and hormones can increase blood sugar. Example would be the epinephrine, and glucocorticoids also can increase the blood sugar levels. So the effects and symptoms also that can be caused by diabetic problems would be either hyperglycemia or high levels of sugar, or hypoglycemia, which is the low sugar. So both of them are a problem, but I think the major thing that people, nurses or healthcare providers like usually focus on, because it's like life-threatening, would be the hypoglycemia. So it's just like crazy if you know, like, because when somebody's having stroke, they exhibit the same symptoms as hypoglycemia. So it's very important, like if you're responding to somebody who's who exhibits symptoms of stroke, to check for their blood glucose level first to rule out the hypoglycemia. So that's the reason why you need to be aware of, like we were talking about the HESTARD acronym, because it tells you like tachycardia, irritability, like some of the symptoms of hypoglycemia. And over here also on hyperglycemia, if you have this one for chronic, like for a long duration of time, it can lead to like micro or microvascular changes. So microvascular changes, it's more of like peripheral blood vessels. So it can be in your eyes, the retina in your eyes, your kidney. It's like basically the smaller distal organs of the body. And then when you're talking about like macro vascular changes, it's gonna be more of like the main ones, like the heart, because it can cause to, like, as we have been taught about, like the arteriosclerosis. So hypertension leads to that. It can damage the blood vessels. Also, when someone has diabetes, right, the indications that somebody, or like the symptoms that people usually would notice, are going to be the 3 P's. So we have polyuria. So basically somebody's like peeing a lot of water because the body is trying to excrete the water out. That's the reason why they teach us also that if you don't have anything like testing available, and to be able to find out if somebody has a diabetes, either you can taste the urine before, like that's what the practice. I know it's a myth or something, but, and that's one of them. And also, like I think I also read before, or people mentioned that, you know, if someone is diabetic and they peed, they let it stay overnight, and then the ants would, you know, try to gather around the pee area because, you know, it's sugary. So the ants like sugars. So polydipsia is like thirsty. So the person's very thirsty because, again, if they're peeing a lot, they're getting rid of a lot of water. So the body's reaction to that is like the body would want you to actually drink more water. And polyphagia is hunger. So it makes you hungry, and then that's the reason why you eat more if you're diabetic. It's not because like you need to be, again, because of the glucose imbalance. That's the reason why the body is trying to like have the person eat more. So there's certain tests also that helps keep healthcare providers to determine or diagnose if someone is diabetic. It can be through fasting plasma glucose. So this one is like you actually have to like fast 12 hours or 8 to 12 hours the night before, so you can only drink water, and then they're gonna take your fasting plasma glucose. The oral glucose tolerance test is when they give you the glucose, and then they see how your body is gonna be able to tolerate the glucose level. So either 1 hour after and 2 hours after, if you hit a certain range, and then, you know, then they would find out if you are pre-diabetic, normal levels, or diabetic level. Urine testing, so that's gonna be the, you know, you provide your urine sample, and from that they test if your whatever level is gonna be normal, pre-diabetic, and diabetic level. The next one will be HbA1c. So this one is kind of like, you know, it has like a scoring system like 5.7. That's gonna be like, you know, and below would be the normal one. 5.7 to 6.4 is the pre-diabetic, and above that would be the actually diabetic level. Also for this, it's good because, you know, you don't have to fast whenever you're doing this testing. It's just because like it tests like the blood itself. So if you have a chronic high levels of glucose, then you know, it would actually show on this test. And last one is the finger stick glucose testing. It's like the one you actually see in the hospitals when they stick the patient and, you know, using a strip, and then you actually be able to tell if, you know, how much is the glucose level. So most of these tests, like, you have to do it twice in different times to actually, so that the provider can diagnose if somebody's diabetic, because also they need to be careful. They're trying to like they try to be careful in diagnosing somebody because, again, insurance rate can go up for that person, and, you know, it's a lifetime problem if they have diabetes. All right. From that, we're gonna do I'll probably talk about the medications in a different video. There's gonna be a lot of time. This one, if we're drawing insulin, because again, this is back from last semester for pharmacology. But whenever we're drawing insulin, right, so we're gonna use whatever injection, and we're gonna pull out the air that we need, how many units. So whatever is ordered plus like sliding scale. Again, we're using the sliding scale based on the so when we're doing a finger stick glucose testing, we're gonna know like the glucose level and how many units additional we're gonna be able to we need to give to the patient. So we're gonna total that, and then after that we're gonna draw how much air based on the units, and then we're gonna inject the air first on the ordered insulin. So we're gonna inject that air over here without touching the medication, and then the next would be to inject the remaining air that is required for the regular insulin, because again, cloudy, clear. And then after that, we're gonna flip this over and then draw first the regular insulin based on the unit that or how much air we injected to it. And then after that, the second one would be the cloudy insulin, and draw that also. Also, we have to like also request another nurse to actually verify if we have the correct dosage, because again, it's a hormone and we don't want to mess up the metabolic system of the person if we giving them an incorrect dosage. Alright guys, so this is it. So again, I'll make a video about the medication, or the medication that is given for diabetes in a separate video. Alright, thank you for watching.